Hi guys, Nicol here. One of the most common things or problems that I come across with the work that I do is that of lower back pain. A number of my clients, when they first come to me, they're suffering. Some of the people in my boot camp, they suffer as well. So what I wanted to do today is just put together a short video to explain kind of the most common causes of lower back pain, and then to give you some sort of remedial stretches and exercises that will help provide you with some relief. Okay, so I'm going to lead you through that just now. Okay, so here we are. So one of the most common causes of lower back pain is the result of what we call an anterior tilt of the pelvis. Okay, so I'm just going to draw a little diagram to explain kind of what that means. So let's draw. Okay, so there's a spine, and here's a pelvis, and there's the legs. Okay, so that's the pelvis in a neutral position. Now, an anterior tilt to the pelvis means, as the name might suggest, that the pelvis becomes tipped forwards, like so. Okay, so you can see the difference. Now, why does that cause lower back pain? Well, if you can imagine, the spine in the first picture is this nice, it's not always straight, but this kind of nice, nicely curved neutral spine. In this position, the spine becomes compressed as it's caused to rotate or extend through that lumbar spine section. Okay, so you get this real compression and a real wave as it goes up and through the spine. Okay, so in this position, what we find are that the muscles in the front of the hips, okay, known as your hip flexors, okay, these muscles here and through the top here, they become short. Okay, so they become shortened. The muscles on the opposing side, your hamstrings, your glutes, on the opposite side of the hip, they become long. Okay, so they tend to also become weak. Okay, because as you'll know from when you exercise, if you stretch a muscle, it relaxes. So if a muscle is constantly in a stretched position, it becomes relaxed and it becomes weak. So we end up with a kind of a dominance of the tight muscles at the front and a weakness of the muscles at the back. Now, we also therefore get an increased amount of tension and overactivity of the muscles in the lower back. Okay, because they're in that compressed position, they're in a shortened position all of the time, so they become what we call hypertonic. Okay, which means that they're kind of overly switched on. So you've got overly switched on muscles in your lower back and underactive or switched off muscles around the hips and through the back of your thighs. Now the glutes, these muscles, okay, the muscles of your bum, okay, they're really the strongest muscles in your body, okay, and their primary role is in hip extension. So when you're standing from a seated position or standing from a bent forward position, such as when you're picking things up, their primary role is to extend the hip or straighten the hip as you stand up. Now, because those muscles can become obviously so weak and switched off, the muscles of your lower back then take over that role, okay, which is why it's so very common when picking up even the most lightest of objects or doing what often seems like the silliest of things, that your lower back will become overworked, over-fatigued, and in the most extreme of cases will kind of, for want of a better expression, will rebel and let go, and you'll get that kind of sudden muscle spasm, or will feel like a sudden ping as the muscles kind of release and give up. Okay, so what causes this anterior tilt? Well, the most common cause is that we spend, as a population, most of our time in a seated position. Okay, so when we're in this seated position, so we have our pelvis here around the hip. Okay, so again, when we're in this seated position, the muscles of the hip flexors, again, are placed into a shortened position. Okay, because the hip is in what we call hip flexion, whereas the muscles of your bottom, muscles of your bum, okay, and the muscles of your hamstrings are placed into a lengthened position. Okay, so when you're sat down for any period of time, those muscles in the back of you, so your hips, thigh, and the back of your thighs, they are stretched, so they become, again, sort of down-regulated, or they become underactive and switched off. And the muscles in the front of your hips, your hip flexors, become tight and shortened. So when you then stand up, we end up with your pelvis being pulled into this anterior tilted position, which causes the compression and overactivity of the lumbar spine or the lower back. Okay. So what can we do about it? Well, Obviously, if you do suffer with lower back pain, the first thing you can try and do is to spend less time in a seated position. Now, I know that for most people that's very difficult, because that tends to be how we now spend our lives. We're sedentary, seated workers. Okay? So what we need to do is to engage in a program of corrective and remedial type exercises. Okay? We need to stretch where we are tight and short, and we need to tighten and strengthen where we've become weak and long, so as to be able to return the pelvis and those muscles to their normal and neutral position. Okay, so restoring what we would call proper function. Okay, so allowing your body to move and function correctly. Okay, so in just a moment I'm going to lead you through some stretches and some exercises that work towards correcting an anterior tilt to the pelvis. Okay guys, so we're going to take you through a series of stretches to remember to try and stretch out where we're tight, and then a series of exercises to try and strengthen where we're weak, okay, with a view to improving or relieving you of lower back pain. Okay. So one of the first muscle groups that we need to stretch is what I was referring to as the hip flexors, so the muscles in the front of the hip joint. Okay. So the easiest way, one of the nicest ways to do this, I'm going to show you two exercises. First is simply to lie on your front. Just rest your chin on your hands, squeeze your bottom and bring one heel up behind you. Okay? Your aim is to pull your heel towards your bottom. Okay? You'll feel the stretch down the front of your thigh. Make sure you squeeze your bum. Okay? That will enhance the stretch down the front of your thigh. Hold for 10 to 15 seconds. You should feel the stretch relax, and you'll be able to just develop the stretch just a little bit further. As a rule of thumb, you should be able to bring your heel towards your bottom and it touch. Okay? So hold for 10 to 15 seconds, and maybe do that maybe 3 or 4 times until you can feel your heel touching your bottom, or until no more range of motion is available. Okay? So you do that on both legs. From there, you would bring yourself into a kneeling position. Okay? The legs the other way around. So in this position, we're going to extend the hips by lunging forward, so as to stretch the muscles through the front of the hip. Okay, so we're going into what we call hip extension. Okay, so you can think of that as taking you as far out of a seated position as possible, so as to stretch that muscle through the front of your hip. Again, in this position, make sure you squeeze your bottom. That will enhance the stretch on the front of the hip, as it encourages this muscle to relax. So again, hold for 10 to 15 seconds. Try and progress the stretch on, and then do the same again on each leg. Okay, so the final stretch that we would do is to stretch the lower back itself. One of the best and most effective ways I've found to do this is simply to lie on your back, legs out straight, raise one leg, and then rotate the hips so as to bring your knee towards the floor. What you need to do in this position is to make sure that the opposite shoulder stays flat to the ground, and you'll feel the stretch come through your lower back. Again, hold there for 10 to 15 seconds, taking nice big deep breaths, and as you relax in that position, you'll feel that your knee is able just to drop that little bit further and stretch through that lower back. Okay, it's very important not to force that stretch. Okay, just allow your body to relax into position and allow the muscles to relax and let themselves go. Okay, so having stretched out where we're tight, we're going to strengthen where we're weak. Just going to give you really one key exercise. We use this with most of my clients at the beginning of every personal training session, and we use it quite a lot in boot camp as well, where we're trying to facilitate those muscles that are weak. Okay, so as we said, the main area where we're weak is around the muscles in your bottom. Okay, so we can give you maybe 1 or 2 exercises. So I'm going to take you to lying on your back with your knees bent. Okay, so as if maybe you were going to do what you might be familiar with like a sit-up or a crunch, but just rest your head on the floor, and from there we're going to press the lower back into the ground. Okay, so you can press the lower back into the ground. That engages the muscles around your stomach, or into what we might call your core, and then from there we extend the hips again, so we press down into your heels and push your bottom as high as we can towards the sky or the ceiling. And in that position you'll feel your bottom should be engaged, tight and contracted. You'll also feel the back of your thighs, your hamstrings, working hard to keep you up as well. If you feel an unnecessary or an unneeded amount of contraction or tension in your lower back, it's normally a sign that you've overextended. Okay, so you've gone and pushed too far. So you just lower yourself down until that eases off, and so that the focus is entirely in the muscles in your bottom. Again, if you are tight in the front of your thighs, it's not uncommon to feel those muscles stretching when you're in this position. Okay, so you hold this position for a count of 10 seconds, then nice and slowly control down to the ground. Again, press your lower back into the floor and push back to the top. Okay, you must push to the very end range of your motion, holding for 10 seconds, and then release and back down to the ground. Okay? So that one exercise will help to facilitate and fire up those big muscles in your bottom and the muscles in the back of your thigh, and will help to bring that pelvis back into its neutral position from that anterior tilt. Okay. Once you've done that and those muscles are active, you would then stand and very simply take yourself into just some body weight squats. Okay? So just hold your arms out in front, feet a little bit wider than your hips, and then sit as deeply as possible. And then as we stand, we push and extend the hips through, so really squeeze tight at the very top. Again, I would perform up to maybe 10 repetitions of those, making sure again you work over that full range of motion. So right to the very bottom, and then push right to the very top, extending the hips through, so contracting those muscles all the way down the back of your thighs and into your bottom. Okay. If you suffer with lower back pain, I would suggest that you probably run through that sequence of stretches, muscle activation, so the bridges, and then the squat movements at least twice a day for a good number of weeks. Okay, to start to reintroduce some freedom of movement around the hip joint and to help strengthen and activate those weakened and down-regulated muscles. Okay, I hope that's been of some help to you guys. If you need any other help or you have any other questions regarding lower back pain or any other joint pain or movement issues, then please do drop me a line via my website www.marknicol.co.uk. Okay, take care guys. Bye bye.